Hi, my name is Dr. Anoki Khanam from the Pediatrics, and I will be discussing the use of inhalers via spacers for the symptomatic relief of a wheeze or asthma. As discussed in my previous presentations, a wheeze or asthma is a result of a bronchospasm causing narrowing of the peripheral airways. This narrowing results in restrictive airflow and causes that whistling type sound, which is often heard and defined as a wheeze. Treatment for a wheeze, first line treatment, is a bronchodilator by the name of Albuterol or Salbutamol, or otherwise commonly known in the market by its brand name of Ventolin. Recurrent wheeze requiring an increased amount of a reliever in the form of Albuterol or Salbutamol is an indication for starting a preventer in the form of an inhaled steroid. Inhalers, otherwise known as pressurized metered dose inhaler, come in this form, both Albuterol, Salbutamol as well as the steroids. You never give an inhaler without a spacer. Giving an inhaler on its own requires advanced coordination on the part of the patient. Children often are unable to coordinate their breaths and hand movements. That is where a spacer comes in handy. My little volunteer, Daniel, will be demonstrating how he uses his spacer.
My name is Daniel Khan. I am 9 years old. I suffer from asthma, and I'm going to show you how I use my inhaler with spacer. This is my inhaler. You shake well before you use, and then you take your cap off. This is my spacer. You put the inhaler in the spacer. You put the spacer on your mouth. You push the button, and you take 10 breaths. You're done with your 10 breaths. You take your inhaler out. You get your cap. You put the cap back on, and you put your spacer and your inhaler back where they belong. Thank you.
The point of a spacer is that the dosed medication is dispersed in the chamber and it diffuses in the air. Therefore, when the child breathes, he is taking more into his lungs than is coming in his mouth or his throat. Before using your spacer, it is always advised to rinse it out with water with a little bit of dishwasher or soap in it. There is no need to rinse it out again with plain water or to dry it. It is all right if your spacer starts looking a little foggy. That is normal. Spacers that have been used for more than 6 months require a review by a local pediatrician or pharmacy to ensure there are no breaks or cracks. The advantages of inhalers is the side effects are less prominent because there is less amount of medicine being deposited on the mouth or the throat and absorbed into the systematic system. They are easy to use, they are easy to transport, and they are more cost effective. In summary, if your child has a wheeze or asthma, you may be prescribed an inhaler in the form of Albuterol or Salbutamol as a reliever, or in the form of a steroid as a preventer, all to be taken with a diffuser, which requires minimum coordination from the child. I hope you found this presentation helpful. My name is Dr. Anoki Khanam from the Pediatrics.